Good morning, afternoon, or evening. Welcome to All Things Social Security. I am Stephanie Joy, the attorney at Joy Disability. Welcome to the channel, and I hope you enjoy the video. Have a great day. Bye-bye. Okay, good morning. I'm going to go over this letter where I have suggestions that the doctor, if the doctor would be so kind as to change some things, because while undoubtedly whatever he says is true, there are things in here that cannot go towards your case. So they will serve no purpose, but they will very possibly irritate the reader, meaning like the judge. And I'll explain a little bit as we go along. And I'll preface it by saying there are certain things that is not within a physician or a DO or any medical person's purview. They don't have the credentials if they don't have the credentials as a vocational expert, by and large, they don't have any expertise to opine on it in any way that will be admissible. And I've seen many times in the past the SSA, because there is a strict rule about certain conclusions being solely the responsibility to come to of the commissioner of the SSA, when a doctor or other medical professional seeks to usurp that expertise, which they don't have. And that's not even to say that they're not right in their conclusion, but they do not have the expertise. They have no more expertise in it than you or I. The blanket rejection, we see it all the time, is the doctor states blah, 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 which is exclusively reserved, that conclusion, to make to the commissioner. And then what seems to happen sometimes is that the whole opinion of the doctor on the things he could legally opine admissibly about are kind of detracted from, because they see that he just thinks he's an expert in things he's not an expert in. And so then they kind of like dampens down the things he does have credentials to discuss. And by the way, just because a doctor has credentials to opine on limitations and stuff does not mean the SSA or the ALJ has the obligation to take it as fact. They weigh the credibility also in relation to, for instance, the doctor's treating records. Is the doctor saying something here that is not well supported by his treating records? Does the doctor not even provide treating records? I know a lot of times mental health providers, for whatever reason that is not helpful to their patients, refuses to give their treating records. I've discussed elsewhere why that might be. In some instances, arguably a valid reason, and I know it's carved out in the law that they can withhold. The other speculation among many is that it's a provider who simply doesn't take good notes, maybe sleeps on the job or whatever while they're counseling, and therefore they don't want to have their records out there, which could come and bite them in the butt, or their lack of records. So they just say, we don't share the records, when they really didn't take any notes at all. I don't obviously think that's true. In this case, this doctor is really detailed. So let's get into the details of what I think should be taken out. And this is going to be a kind of a learning exercise for others too. So everything will be kept generic and not specific. So in the first sentence where it says the patient has been under my ongoing expert care since, some date in 2025, I would take out the word expert, because the credentials speak for themselves. And it looks like little man trying to make himself big man. Doesn't need to do that. So I would change that to the patient has been under my ongoing care since whatever date. These are the little things and I know he's aggravated that they have not supported you and that you didn't prevail. And so he's aggravated on your behalf, which I think is very heartwarming. And I appreciate his compassion and care to his patient, which is kind of a rare thing in modern day. I don't see it a lot. So then, okay, the next part is okay. The rest of that sentence, maybe the second sentence that starts with, please do review my prior report dated so-and-so, that is okay. But the last part of that sentence that says this was about 10 months ago, then can you be quiet, please? I mean, just, could you close my door? I have to get this out before I go. So sorry about that. I had an interruption. You don't have to tell them how long ago that date was. They can do the math. So by saying this was about 8 months ago or 10 months ago, whatever, that's like treating them like a child that you have to spoon feed basic math to. I don't think it'll come off well. So a lot of this is about diplomacy, not incorrect. I mean, that's obviously accurate information, but you're trying to not alienate the judge whose sympathy and compassion you want, aside from his professional judgment. So I would eliminate that. And we're still in that first paragraph. Then the last sentence is saying, note the then attached blah, blah, blah form and the name of it, which continues on to say that this report is noting many extreme and marked limitations and some other
limitations such as absenteeism. Extreme and marked, you could keep those in there. I'm not really favorable on the quotations only because it screams that I'm trying to fit the lingo of the SSA so that you might believe me better because, so they can stay there because it's probably it's probably the form where those are the actual words used, so I get it. But generally speaking, the more legalese a doctor puts in a report as a general rule, I would say the more it looks like he's trying to fit the case to meet the law, and that takes away from his credibility as a doctor being unbiased, unconflicted, and not trying to fit his patient into a thing where he's going to get cash benefits. So it's just better to be more objective and not give the impression that one's trying to force feed the result. Second paragraph, we say what is updated is that the patient continues with, okay, quote, severe level XYZ mental health diagnoses. I would take the quotes off of the severe. Again, it's force feeding in a condescending way. And I know that's not necessarily the objective, but maybe it was because I know that I could tell he was very irritated with the SSA, and I totally understand it. But we don't have to wear that on our sleeve and become adversarial with the next part of the SSA, which is the ALJ, who's never seen this case before. So I would take the quotes away from severe, but leave the word in there. Despite being appropriately engaged in the next sentence under paragraph 2, take the quotes out of the word severe. Okay. This sentence, I mean, if it gets fleshed out later, which I'm guessing it does, the sentence, these symptoms create extreme functional limitations and make the patient functionally impaired and thus mentally disabled. Get rid of mentally disabled. If he's referring to disabled under SSA law, he's not credentialed in that. He's not an expert in that. He does not even know all of the rules, which would include knowing all 12,000 jobs that the patient has to prove he can't do. And something tells me that the doctor's a little too busy to become a vocational expert in 12,000 occupations, right? So I would perhaps change that to something like this. These symptoms create extreme functional limitations, so that's fine, and make him, well, it's kind of redundant, make him functionally impaired. I would just probably leave it as these symptoms create extreme functional limitations as noted below. And we could always come back to that one. Moving on, this has got to come out. It appears that you and your hired reviewers, parentheses, some internal medicine physicians that are not fully trained or experienced in advanced psychiatry, some are psychologists and not trained or experienced in advanced psychiatry, do not understand or accept this. Take it out. Take it out. It is now becoming a pissing match between the treating provider and other acceptable experts in the field. That's not to say I don't understand his point. I absolutely totally do. Not only does he have psychiatry and he does therapy with the patient, so it's not like just a medications management pushing type of doctor. He's the treating one. He's done it time and time and time again, whereas these people either never met patient because they are SSA, they're other consultative examiners, or sometimes it's just a person behind the scenes that has to review the medical records, which, as I understand it, your doctor didn't provide, and that's part of the problem here, and then come to a conclusion about what's credible and what's not, given what is supported by the record. And here there is no record because the doctor chose not to provide it. But they are legally acceptable experts, and I don't think stating the obvious is helpful because the judge is already going to know the difference. Again, you gotta look at it from the perspective of the audience, which is the judge. Is this going to be something the judge didn't know and the doctor's informing him of the law? Do you know what I'm saying? So you have to try to lean into more diplomacy and unbiased, conflicted statements rather than wearing the devotion to the patient and the aggravation on the sleeve. Because then when people are emotionally aggravated like that, their opinion becomes less credible because they are filled with emotion and not just their knowledge. So I would take that whole sentence out. It appears that you and your hired reviewers. And then the next sentence is, this does not make sense to an expert senior psychiatrist, and it is very bad and damaging to the patient. Take it out. They don't need to know what makes sense to the treating provider or not. That's not part of your case. And then so I would take that sentence out too. And the next one, please see the attached 3 assessments taken during the last session, Friday, which was very recent in 2026. That's okay, demonstrating his ongoing severe problems despite receiving comprehensive modern care. That's good. That's just factual. And then there's the ABC, which describes those findings, at least the major parts of them. Let me just make sure there's no inflammatory words in here. Nope. So that's good. That's all just flat out medical findings. Third paragraph. I know we're going to be here a long time, and I'll read that in a second and then get back to you. So I'm just going to turn this off for a minute. Okay, back to paragraph 3. I would get rid of most of this. You don't tell the ALJ what as you know, at least not when you're being antagonistic. It's not going to be helpful. It's going to, like, you're already making a person not want to go with your opinion, not you, but a doctor being condescending and elitist to the judge. It's just not smart. Now, and number 3 is there's no problem with saying that the patient was previously seen for over 14 years by the federal VA mental health. I would change the word expert because that's actually a legal definition. Professionals, you could say, at the whatever VA location, blah, blah, blah. But that part is not so bad. But then the next sentence, again, as you know, he is 100% P&T. I don't know that you need to have that spelled out for the judge who's fully aware. So again, it's like feeding him with a spoon as if he doesn't know, which can be very insulting. And again, we're dealing with humans and we want them to be warm and, not already with their like building up a distrust for a report. I mean, there's a gentler way, I suppose one could say that. As you know, he is 100% service connected with the VA. This is due to his, and then you name the conditions. That's fine. Saying, and this part right here is not horrible. I've reviewed the patient's past mental health records, and I conduct reevaluations each time we meet, which is frequently or whatever. The patient or my ongoing clinical exams and these mental health quantitative measures are in agreement that the patient remains very symptomatic, very ill. With this part is a little redundant, but that doesn't matter. With extreme functional limitations and functionally impaired. If you have extreme functional limitations, you are functionally impaired. Doesn't mean you're disabled under the law, but it means you have impairments that are limiting. The bolded sentence, I think we've talked about this, has got to go. The first sentence of the bolded part, the patient is very disabled by these. That's just, I mean, now you're just, again, throwing out the conclusion to the judge when it's up to the judge to decide. Better is to have the details of, don't say disabled when you don't know what the vocation rules are for all 12,000 jobs. So what you do is you lay out the tasks, the mental tasks that the patient would be extremely limited in, and give examples. So we'll see where this gets us, because I know I'm only on page 2 of 6. The last sentence, take it out. The patient is clearly both totally appropriate and deserving for federal SSDI. There's not a matter of deserving. Deserving is not under the law. If someone is a complete a-hole and they are disabled and they paid in for it, it's their insurance, they get it. So again, it's trying to fight for a point that is irrelevant to the law. And when people do that, I see patients do it all the time, clients. It's almost like they're basically saying, I might not have all the medical goods I need to win this case, but I'm deserving. So I'm going to tell you what a good person I am. That's basically saying you don't think you have enough of the goods on the paper the way the SSA needs to see it under the law, right? So I would take that out. I would take the whole bolded part out. And I think we touched on that before. All right, so I'm going to read the next paragraph, which will be paragraph 4. Okay, I appreciate paragraph 4. However, there would be a way to say that is not derogatory or fighting something that happens to be legally permissible and regular in the SSA system, because you're not going to win that battle, right? So he's talking about in the summer of 2025, our past hired reviewer. What this doctor is forgetting is that he's also hired by the patient. So he's slamming in a subtle way the fact that the reviewer, who was a doctor, was hired, but so is he. So maybe you want to pull that out of there, right? And I would just say, in the summer 20, say the SSA internist that reviewed the case. Well, I'll just go through the sentence. Internal medicine doctor, not a psychiatrist. Again, you don't have to, it's like treating the judge like he's a kindergartner and doesn't realize that. So I would take that whole part out. I could say an internist and leave it at that. That's going to speak to what his point is without saying not a psychiatrist, because again, he keeps patting himself on the back. Sometimes you do not have to say things and they're going to have more impact by not saying them. Stated in his brief review then that my then 4 to 5 months of working with the patient was not a meaningful duration of the case. I think if he puts it in a way that's just factual, and that could be, as long as he gets rid of that other part we're talking about, was not a meaningful duration of care. And then he says, well, as of today, I now have spent about 13 hours over 11 months sitting with the patient in a small and quiet private. Okay, that can be stated, but I would state it differently. I wouldn't say, well, as of today. I would just say, as an update, I have now spent about, and probably by now it's 14 hours, over 12 months, over a year, a full year, sitting with the patient in a small, quiet, private room every few weeks, carefully chatting with the patient and listening to him and watching him closely. That's good. But again, take out the, you know what I mean? He goes on to say, my observations and findings are the same now as many months ago. I mean, perhaps say my observations and findings today reinforce exactly what my professional findings were however many months ago. I don't know how, 8 months ago. And continues to be consistent with, I wouldn't say the VA disability reviewers, because that's a completely different law that has a different set of terms to be disabled, but he could say, and many VA mental health physicians and providers. And then it says comma, and then this is bolded. Patient is clearly very symptomatic mentally, very functionally impaired mentally, and with both severe level and chronic mental health disability. I mean, he could leave that in there because it doesn't talk to, I mean, technically, you can't say that about someone being disabled under SSD law. What you do is you show them how the person is. So they come to the conclusion instead of the judge trying to say, he's disabled. End of story. I'm the expert. Not going to fly. I probably wouldn't say the word clearly again in the next sentence. First of all, you're shoving into the judge's face that if he doesn't see it, he's blind. Do not need to ostracize the judge that way. I would rather the doctor appear to be a compassionate doctor that is not stoking his own anger at the SSA, but is just compassionate and knows all about you. So the last sentence, he, instead of saying clearly, he could say he is both totally, oh no, this is a whole sentence he's got to take out. Again, he says he is clearly both totally appropriate and deserving for federal SSDI. Get rid of that. Again, if you're fighting on the fact that someone deserves it, you're already losing the battle. Oh, I guess this is only a 2-page letter. Number 5. I guess the rest is just attachments. Cool. I continue to advise the patient to not work at all, but to focus 100% of his time and limited energy on his greatly needed mental health treatment, healing, and recuperation needed between treatment sessions and aftercare assignments. His conditions are severe and chronic. He could also throw in a prognosis that with a very guarded prognosis. Prognosis never hurts. Now I'm just going to look at the attachments. Okay, because these are, I mean, it's good. They're nice and recent. Okay, so the first attachment is obviously the patient's answers. So that's not a medical finding. Okay, looking at the attachments, it looks like, I'm not sure, that none of these are actually the doctor's findings. And I know with mental health, they have to go a lot on what the patient says, but these are, I think, filled out by the patient. Is that correct? So it's just the patient statement. They're not going to hold as much water as if the doctor had treatment records where the doctor says, on this day, he was very irritable, very unable to follow a sentence, couldn't concentrate. I had to keep redirecting him. The actual observations that support, versus just, hey, the patient says he's extremely depressed, therefore it's extreme. So that is a weakness, and that is one of the problems with providers that will not buck up and provide their treatment records. We've kind of talked about that. It would be nice if they did the basics, which I think actually they're not allowed to. They're only allowed to carve out their psychotherapy notes under HIPAA. They are not allowed to be excused from providing everything else about each session. So you have to question when a provider does that. You just gotta wonder, like, what was the mental status exam, the mini status exam, or the mental status exam at each session? What was the person, why do you believe that the patient who is not a doctor, what he's talking about his perceptions, but that's not, he can't self-diagnose. He can't provide medical proof of anything. So this is where the weakness lies. There's nothing here to suggest that the doctor filled these out. I'm guessing it's the patient, and talk is cheap, So the rest of the letter is really good, except those things that detract from its credibility. And it's because of the irritation. I know it and I get it. And I appreciate the doctor even doing this, because I want to say 95% or more won't do it. They just will not do it, or they'll charge their patient like $500 to do a 1-page letter. It's pretty sickening. So anyway, that is my thoughts on that. Hopefully I can sum these up in a little writing, because I know this has been a long video. I'll talk to you later. Bye.